Fox 56 News Chief Medical Contributor Dr. Ryan Stanton is with us once again in studio.
In this segment, he continues to focus on the new vaccine standard issued by the White House.
And this really is about giving families some clarity in terms of where do you go from here. We have conflicting information from federal agencies now against professional medical organizations that are at odds. Where do you go? Well, we're going to answer some of that. Vaccine recommendations should never be frozen in time. Medicine evolves. And when better evidence becomes available, physicians expect recommendations to change. That's exactly how science is supposed to work. Follow the evidence, not the emotions. The concern with the new White House executive order isn't that it changes recommendations, it's whether those changes are actually supported by the existing body of evidence. First, the executive order revives questions about vaccines and autism. That issue has been studied more extensively than almost any other vaccine safety question, with research involving more than 5 million children across multiple countries. The conclusion has remained remarkably consistent. Childhood vaccines, including MMR, do not cause or increase the risk of autism. Second, the order encourages more individual vaccine visits. The problem is that every delayed vaccine extends that period when a child remains susceptible to those preventable diseases, particularly during ongoing measles outbreaks. Third, reducing recommendations because another country uses a different schedule can be misleading. Countries tailor immunization programs to their own disease risks and health systems. The appropriate question isn't who gives fewer vaccines, it's which approach produces the best health outcomes based on the available evidence. That's why the nation's leading physician organizations continue to support vaccine recommendations built through rigorous scientific review. Their position is straightforward. Continue studying vaccines, continue improving recommendations, and when the evidence supports change, change. Until then, the science, not the politics or party affiliations, should remain the foundation of vaccine policy. So that's really what it boils down to, is we need to really trust the science, trust the medicine. And Christy, you mentioned earlier about doing research and wanting to have choices. Medicine and the training and the thing that goes into being a great researcher, not just physician, not just scientist, but a researcher, takes a lot of training, a lot of experience, a lot of things in place to make sure that it's clean and accurate. And we want to make sure that we lean on that research to build our recommendations as we move forward.
What do you say to the people who are in support of this change because they want to have more choices on what vaccines they give their children, maybe because they distrust giant pharmaceutical companies?
I mean, there's nobody who distrusts pharma more than physicians. That's just a matter of the fact. You've got to prove with the evidence. Show me the evidence before we move forward with something. The key is do research. Make sure you get evidence, but make sure it's trusted and quality evidence that you're looking at. And understand that if it falls back to where the recommendations currently are, you need to lean on that because that is actually what is out there. Trust me when we say, remember where we were before vaccines. Average life expectancy of 40 to 45 years old. 20 to 40% of children did not make it to age 5. Vaccines work, vaccines save lives, and especially children.
And again, what's a credible source that you recommend?
The one that I like is Open Evidence. It is an AI-based large language model, but it uses approved evidence, New England Journal of Medicine, JAMA, groups like that, to actually pull that and not getting from these fringe areas where the research maybe just opinions are made up.
All right, Doc, thanks for coming in.
Thank you.
We'll be right back.
You're watching Fox 56 News, our home, your news.